been overlooked.
Watch Book TV every weekend on C-SPAN 2.
Representative Rashida Tlaib has turned down Israel's offer to allow her to visit her grandmother in the West Bank, tweeting, "Silencing me and treating me like a criminal is not what she wants for me. It would kill a piece of me. I have decided that visiting my grandmother under these oppressive conditions stands against everything I believe in, fighting against racism, oppression, and injustice." Earlier this week, Representative Tlaib was one of the participants in a town hall on health care hosted by community organizers from the Detroit area in Highland Park, Michigan.
Now, this is a serious question that we have to address. We have panelists today that are going to talk about this specific issue. The question is the question of what do we do for folks that need long-term care? What do we do with our seniors that want to live at home but maybe need a little bit help, just a little bit of help, making sure that their ducks are in a row? These are the things that we are trying to talk about today when we talk about things like long-term care and family care. And then the other point, when someone in your family gets sick, you shouldn't have to worry about, will I get paid today? We need to talk about a serious paid family medical leave that if your child gets sick or your grandmother falls, that you can take some time off to make sure that they're okay emotionally, they're okay physically, and they're okay mentally. And that you shouldn't have to lose your pay, you shouldn't have to lose your job to do these simple acts. And that's what we want to do when we talk about paid family leave. So all of these things are encompassed in what we like to call the caring economy. The caring economy guarantees every single person in this country is respected no matter what. And we don't talk about just the folks that are getting those services. We're also talking about the folks that are providing those services. Because here's the thing, you can't automate the human touch. You can't automate that care that a senior needs with a home care worker. That just will not happen. So the question we have to ask ourselves is, if we really respect our seniors and we talk about respecting our elders and our kids, are we going to treat the folks that are providing that child care, that are providing that senior care with dignity and respect? Are we making sure that they are not going to get sick, that they don't have to lose their job because their daughters or sons or mothers and sisters and brothers get sick, that we take care of them too, that if they need time off, we'll give them time off. And if they need to collectively bargain for higher wages, they can do that. And that there is a minimum wage, so they're not taking care of someone for $9 an hour. Because I'll tell you what, you ask any of these greedy billionaires, is taking care of your mother worth $9 an hour? They'll tell you no. If we really respect our seniors and our kids, is taking care of your kid worth $9 an hour? Or is it worth more than that? So we have an incredible group of panelists, and I'm going to have them introduce themselves to talk about what it means to build a caring economy, one that is all-encompassing, from when you are born, making sure that you have the services that you need, and that when you get older, that your parents don't have to worry about teaching you how to read or making sure they can pay the bill so they can feed you, to all the way when you're older. Right? And I'll close with a personal story. I have an older brother who got sick in 2013. He already had severe autism, could not communicate like regular folks, and he required full-time care. Now in 2013, my brother got really sick, got diabetes, lost some motor function in his legs, and is now dependent on a full-time trach. Has to breathe from a little hole the size of a McDonald's straw on his neck. And I think about the privilege that we've had in my family, that my parents got busy and had 8 kids, and that we're a pretty tight-knit family. So we were able to all chip in to make sure that we take care of him. We're all making sure that we know what we can do to suction him when his trachea gets gets messy, that we help him walk to the bathroom when he has to use a restroom, that we monitor his food so he doesn't choke, and that we're making sure he's taking his meds and everything in between. But I think about the folks who have one child, and I think about the folks who have one parent or live alone and are dealt with these circumstances. What are we doing to make sure that those people get the same amount of care and love that we're able to provide for my brother? And I'll tell you, even with 8 kids, we still need help. We still need help to make sure that he has all the supplies he needs. And I can't tell you how many times I'd have to call the insurance company to get what they love to call prior authorization. Anytime something changes, if he needs an adaptation in his medication or his supplies. So the question is, how are we going to make sure that we are building that caring economy for all these people, people like my brother Webb, and everyone in between? And this incredible group of panelists are going to talk about what it means to invest in childcare, what it means to invest in long-term family care and senior care, what it means to invest finally in a Medicare for all single-payer system, and what it means to make sure that all those people who are working in that industry are treated with dignity and respect, and they too get that care that they deserve. So without further ado, I'll shut up, and we're going to have folks quickly introduce themselves. We're going to start off with Bria. So Bria, I'm going to hand this back to you. Sorry for stealing your mic.
Hi, my name is Bria Lewis. I am recently became involved in attending some mothering justice events, and on the whole, just looking forward to delving further into these issues, as well as hearing from the perspectives of the other panelists.
Hello, everybody. My name is Rokesh O'Neill. I am an unlicensed child care provider. I'm also a part of Mother and Justice, Michigan United, and a whole bunch of other groups because I'm trying to help clean up our city. And part of cleaning up our city is we need affordable child care and Medicaid for all.
Hello, everyone. My name is Dequan O'Neill. First of all, I want to thank you all for coming out. I see it's a diverse crowd. We have youth, we have elderly people here, we have different race here, and we need that. And I also want to thank our councilwoman for being a champion of change, for fighting all these issues. I know it's tough out there, especially in that crazy White House, but in that crazy Congress. But you definitely fight for us, and I'm glad you're a part of Detroit, and thank you for that.
Thank you.
Thank you.
I want you all to know the only way we get closer to universal health care is from your activism, from the work that happens outside of the halls of Congress. So thank you. Thank you for being a voice for so many that can't speak up because of the issue of our broken, inhumane health care system. And so I'm really honored to be here as your member of Congress representing the 13th Congressional District. I can tell you that this new class is not only diverse, but it's also real. Many of my colleagues actually, one in particular had no health care until she became a member of Congress. Another has a pre-existing condition and knows what it would mean to take away that protection. Another lost her mother because of our broken healthcare system. So not only are we diverse in the makeup and our backgrounds, but we also are so real in how we've all been impacted by this broken healthcare system in our country. And so I hope you have so much hope that we're going to get to single payer, that we're going to get Medicare for all, that we're going to fight back against the corporate greed that is an assault on working families, that charges thousands and thousands of dollars for insulin for people that this is all they need is to survive is insulin, things that we, the government, subsidize for, that we paid for the development and research of. We should be able to provide for our families very easily. It should not be this tough. But thank you, because I'll tell you, anything transformative in this country, I don't care what it was, if it's the civil rights movement to the women's rights movement, it really happened in the streets with people like you. So continue to fight back. And thank you for that sign, because when I came out first day, now the majority of the Democratic caucus now supports impeaching this president. So I thank you all for supporting me on that.
Good evening, everyone. My name is Vernette Mahone, and I stand in total agreement with Michigan United Mothering Justice, Carrying Across, and Empire Alliance. Thank you.
Good evening, everybody. My name is Henrietta Ivey. I am a Detroit advocate for home care workers and activists in my community. I want to thank everyone for coming out tonight. I want to thank Congresswoman Rashida Tlaib for coming out tonight. And we have some stories for you.
All right. Can you, mic check? Is it on? I can't tell. All right, now I can tell. So we're now going to hear from our panelists up here. They're going to share a quick story about their personal stake in this game. We're going to start off with Henrietta. If you guys can tell us in a couple minutes what brings you here, how you're impacted in what we are trying to build with a caring economy, and why you want to keep fighting.
Well, just like the Congresswoman said, you know, health care for all is necessary. I am also a victim at one point where I've lost my job that actually gave me full health care coverage. Now, once I lost my job, I went 2 years without health care coverage. And so that prevented me from going to the doctors and finding out, you know, if there are any issues going on with me. By the time I was eligible for the Medicare expansion, and I did go back to my physician, I had developed diabetes. So, and I found out that I developed diabetes is when I went through the emergency room and I had a cut on my finger and it swelled up. So they did a test. You know, they do those preliminary tests when you go through the emergency room. And when the doctor came back and said, well, I have good news and bad news, I panicked. Because I'm like, good news and bad news, I'm healthy as a horse, always. So I figured because I had lived a healthy lifestyle that, you know, going 2 years without insurance and not being seen by my physician would be okay. Well, it wasn't. So I was diagnosed with pre-diabetes, which now I'm actually a full-blown diabetic. So I'm here tonight to talk about the caring economy and how important it is for this Medicaid expansion for all, that there are families out here suffering who cannot go to the doctor because they don't have health care coverage. I'm here to talk about the big insurance companies because that is a tragedy when we cannot have insurance to cover our basic needs. So I'm here to talk about what can be done. My stance in there, I'm fighting with, you know, Congresswoman and my panelists up here to make sure that this message gets across to the lawmakers that we need Medicare for all. It is a human right.
Yes, I would also like to thank God for another chance to share my story. Thank you, Congresswoman Tlaib, and for the co-hosts, Michigan United and Mothering Justice. Thank you for this town hall. And thank you for allowing me a few minutes of your time to share my story. After high school, I had went into my choice of, my path choice was technology, and I wanted to become an entrepreneur. I went to work, I went to school, I had 5 children, and I also noticed my mother was aging. At that time, I was young, and when you're young, you just take on the world. You can do it all. You don't think about the consequences because you have the energy and you just do it. Well, I became my mother's caregiver in 1999 when I noticed she needed special needs. This was, in the state of Michigan, they allowed my mother $5.15 an hour for 20 hours a month for her to pay me. That was not working for me. I still had to work. I had to finish school. I had 5 children, and I also was planning to get married. Well, I thank God again because we made it. In 2014, my mother passed away at 88 years old. She lived in her home, she was healthy, and she was in love. She was surrounded by her family. Even though it was hard, it was not easy for me and my family to balance taking care of her and taking care of ourselves at the same time. So I believe that working together is the key to having a successful and healthy community. I learned this from my mother, who was also a teacher and a community leader. She always was going above and beyond the call of duty. I lived in my parents moved here from Georgia, and I've lived in your district for over 60 years now. And I love my district, I love my community, I love my state, and I love my country. And right now, the people are suffering, and some are even dying because of the lack of care. This is unnecessary. It's a horrible situation that for the last 20 years, I have stood with 55,000 home care workers in the state of Michigan that said we are invisible no more, that we are stronger together. And if we, then in 2005, we had a voice. Our united, we had first wage increase. We also had a voice that made it clear that if something wasn't done then, it would get worse, and it did. We're in a crisis right now. There's a shortage of 32,000 home care workers in the state of Michigan, and we need those workers by 2020. The people that are not getting the care are suffering because the workers are not being recognized. We need this caring economy so that we can build up the workers, so that people can have the care that they need, and we can do this together, and let's use the united we stand and make it work. Thank you.
Hello, everyone, again. Is there any fathers in the house? Can you please raise your hand? I want to give you guys a round of applause. Can we get them a round of applause? Like, seriously. I'm here to talk about health care and also child care. The reason I wasn't even necessarily here for health care, but it hit our country hard a lot, and I'm kind of getting sad thinking about it, but I lost my cousin 2 years ago, and I was working for the Michigan Democratic Campaign, by the way, and it was a tough time for me. He died 39 years old due to diabetes. But he didn't have health care until the last year he was alive, and it was really too late. And I just think that it's important that we all have affordable health care. Like myself, I haven't had health care for the last 2 years. Haven't been to the dentist in 2 years. Thank God I still have nice teeth, but it's serious. It's a serious thing. People get sick all the time, and a lot of people don't have money, and we have people that's getting rich off of us getting sick. It don't make any sense. I can't stand it, the thought of it. But that's my little spill on healthcare. And this woman right here is my mom. I love you so much. I have to thank her so much because the support she gave me, I was fortunate. But a lot of my friends and even relatives have a problem with childcare, I'm sorry. Childcare. I know a lot of people who lost jobs due to not having a babysitter. And it's sad that you can't find some support because, honestly, a lot of fathers are not around. That's why I said the fathers in here, y'all deserve a round of applause because a lot of fathers not around. I grew up without my father, so I know how it feels. And I see some people raising their children without their fathers. It hurt. So they really don't have that support that they need. I'm lucky enough to have the support from my mom, and I really do thank you for that. And that's why you need to get your license so you can help out more people. But it's been a roller coaster ride. I'll be honest with y'all. It was times I didn't have a babysitter. My mom was doing something, and I couldn't afford it, and I had to get to work. And the job didn't understand that. They didn't care to understand that. You know, they just want me at work. And I understand, you know, it's a job. I have to do what I have to do. But they never really took the time out to understand where I was really coming from. So I called off 4 times due to not having a babysitter, and I was fired. So that's why I say it is important for us to have affordable child care. And thank you guys for giving me the opportunity to speak and listening to me.
And I got to go behind that. I'm sorry, my mic. I said I have to go behind that. Being an unlicensed child care provider, it gives me the opportunity to help families in need. Because affordable, we have to think of reasonable, because they don't have reasonable price for child care. And when we think about affordable child care, we have to think about the compassion that people have when it comes down to watching people's children. And then I tell people I've been doing child care for over 20 years unlicensed. That's why he said I better get my license. But I like doing unlicensed. But because it shows that you care, because I have to do the basics. Sometimes I have my neighbors to watch their children just to go to the doctor. Because when we talk about affordable care, we also got to be holding people accountable. And that's ourselves. By even when he asked the first question, how many of us have health care? A lot of us have health care, but a lot of us take advantage of our health care but not going. So we have to start using our health care. And those who don't have health care, we need to push and say, hey, we need affordable health care for all with no excuses. Because I feel like the taxes we pay our taxes. Where's our money going? So let's tax the rich and make sure that we all living healthy and strong because we have health care. So I'm gonna turn the ball on over.
Well, I've been asked to briefly address the topic of paid family leave. And my perspective comes from really 2 different angles. One is in part the work that I do. I work in legal services. So I hear countless stories of people having to make these choices. And that in many cases, what starts off as a call about eviction, upon further discussion, turns out, well, this person had a child that was hospitalized, or has a chronic illness, or had to choose between taking this time off of work and caring for their loved one, and they chose to care for their loved one and were ultimately fired. And I'm also coming at the perspective of coming at the issue on a personal level, because I recently had to take advantage of family medical leave, but had to do so much sooner in my current pregnancy than I planned. So that's, it becomes a question of doing what is financially preferable versus what will result in the best result for my health and the health of my unborn children as well. And so in listening to everybody, I kind of concluded that I'm really at the intersection of a lot of these issues, as many other people are, in that, I'm navigating what the system offers in terms of leave, as well as childcare, additional childcare costs, as well as the work of actually caring for children. In the past, my husband had to go back to work within a few days of having given birth, and a lot of the support came from my mother. My mother is now caring for my grandmother, who is 90. So there's a long-term care issue in that as well. And my grandmother deserves to, age with every bit of the dignity that she has lived with. But it does shift the dynamic of what my options are. And my, the choices that I'm facing are more an example of the piecemeal approach to caregiving that we have. And my circumstances aren't nearly as dire as a lot of other people, but nevertheless, it is a piecemeal approach. So instead of focusing on, my well-being and the well-being of my children and my family, I'm focused on doing the best with the pieces. But people make do, and people have been making do. Making do for me means that. Making do for other people means, do I get evicted or do I take care of a sick child? And then the question becomes, how long are we satisfied with just making do?
Right.
You know, how long is making do enough when we can do better? Other countries with resources, you know, with far fewer resources than we have, manage to craft policies that serve their economy as well as their citizens. So why can't we do that? And so along with the other issues, paid leave is as much an opportunity to promote the economic, you know, the social, the familial well-being, and advance the interests of our citizens in that way. And so having established, which you know, has clearly been done, the need, or what is a national need, how do we then make it a national priority, which seems to be what should come next.
Thank you so much. So, Congresswoman, look, we know the stats. 70 million people can't afford the health care that they need. Next year in Michigan, we need 32,000 more home care workers to make sure that folks have the care that they need. And then, you know, people lose $20 billion because they don't have access to paid family and sick leave. So if you can touch on what it means to really fight for, first, the caring economy, and then also what it means to have a Medicare for All system.
So for many of you, you came here because of a specific issue, and a lot of folks talking about Medicare for All. But we're also, if you hear the stories that you hear here, the intersectionality that is happening, it's about creating a caring economy, a caring system. So it's not only do we want Medicare for All that's going to cover long-term care, but who's going to provide the long-term care? Who are the people that we need to employ and to make sure that they have human dignity as well, not only the people we care for. We also want to make sure those that are in the workforce, they have paid sick leave. So again, creating a caring economy and making sure that our folks, when they want to take care of their families, they have a child, that they're not back at work within a week, that they're able to be with their child, their infant, and for us to be setting around these values around family. And so it is about expanding access to care. And we always talk about coverage, right? We always talk about making sure people are covered. But what does that actually entail? Does that actually entail who are the people that are going to take care of our neighbors that need the care, who are the people that are actually in the workforce that need coverage and paid sick leave. So it's very important as we talk not only about Medicare for All on a national level, that's what people focus on, but all of the other elements that we've all been fighting for here in Michigan, especially around paid sick leave, especially around a care workforce that is really, really lacking, organizing around that, making sure that they have fair wages and so forth. So it is important for us as we talk about Medicare for All that in the same breath that we're talking about other things, 90% of us prefer to age in our homes. I didn't even need to see that statistic. Going door to door, I talk to my residents. They don't want to leave their homes. They want to stay there, and they live longer when they stay in their neighborhood and stay in their homes. So we want to support that. Only 17% of workers currently in the United States right now has access to paid family leave through an employer. Fewer than 40% have access to short-term disability insurance. Think about that for one moment. People are an accident away, but more importantly, people have to choose their child over, like, work over their child. Think about that. Nearly 1/4 of moms go back to work within 2 weeks. 3 out of 4 men in professional jobs return to work in 1 week or less after having a child. American families, like I think Abe talked about this, lose $20 billion in lost wages because they lacked access to paid sick leave. And it goes on. And, you know, when folks talk about this in other states, not just in Michigan, I think we get it here, especially in my district. It is supported overwhelmingly. 8 in 10 voters support raising new revenue to pay for a national paid family and medical leave program. 8 in 10. They want the kind of support that is there to make sure that people are in a humane system, that the folks that are around them are treated with human dignity. And so it's really important as folks talk about this, push back, because if there's anything that we want to pay into, it is a system that works for all of us, because every single one of us is going to end up having to touch a care worker. And we're going to have to touch a child or a worker that is, in need of paid sick leave. So make sure as we talk about Medicare for All, as we try to push for universal health care in our country, that we also talk about all of the elements that, to me, create the caring economy, the caring system that I think is really, really critically important. Coverage is not enough. We have to make sure the other systems are in place. Thank you.
All right. Thank you. Thank you, Congresswoman, and the incredible panelists. So we know that it's important, like you mentioned, that the people who are caring for us are not getting sick. So that they need to take time off, or that they're not stressed, so that if they have a crisis going on at home, they can take a day or two off to make sure they get their things situated. And all of you guys really talked about the need to make sure that, one, we have a serious comprehensive healthcare system that covers everyone, no matter what, right? Doesn't matter if you're the richest of the rich or the poorest of the poor, that you have access to healthcare. And that when folks get old or when folks have a long-term illness, that they do provide the care that they need, and we're making sure that the folks that are doing that care are treated with respect, have at least a $15 minimum wage, have access to a union, and that parents have access to something like childcare, so that if you're a single dad, you're able to take care of your child and work, or if you are providing that child care, that you get the respect and dignity that you deserve. And then overall, really talking about the long-term care. So we have two things on the table. We have a caring economy, and that's encompassing really everything that we just talked about right now. And then we have Medicare for All. And today's event is a community conversation. So we have the panelists up here with the Congresswoman to listen to all of you. So in order to make this as fair as possible, we're going to take a question from here and a question from here. If you have a question, you raise your hand. I'll come over and talk to you. Most of the questions, I guess, will be directed towards the Congresswoman, but please tag in any of these incredible organizers and folks who are impacted by these issues, because I'm sure that they have a lot of insight to address some of these questions. So the point is, don't fall asleep, any of y'all. So just make sure that you listen. So we're going to start off with the first side to my right. If anyone has a question, if you just raise your hand, I'll walk over to you, hand you this cool mic, and then we'll jump to the other side. So state your name, a quick, brief reason why you're here, and then give us the question that you're asking. So how are you? My name's Abraham, and your name?
My name is Chris.
All right, Chris, here you go. Take it away.
Thank you very much for being here this evening. The question I have is really, I feel like I'm part of the caring majority and support all of these issues. I think that some of the pushback I hear when I just talk to neighbors and friends is not that they don't support Medicare for All, and they're even willing to pay for it, as well as these other issues, but they do seem to have a concern about what that does to family dynamics when everything gets pushed over to professional caregivers. And so when I talk to my neighbors and so forth, I hear that, and I wonder if you've heard it, and if you have, what kind of response you have to that, because I don't have a good thing to say.
So in regards to creating this kind of caring system, I can tell you in Michigan, we had a home health care organization. Specifically, it was family members that were actually getting paid to stay home and take care of their caregiver, their loved ones. May it be a child, maybe someone that requires long-term care, so forth. But instead of bringing an outside person into the home, we actually were a state that trained family members and paid them. It was very small amount, by the way, very, very small amount. But it covered transportation. It covered some of the basics. It wasn't anything to get rich on because they had multiple jobs, but it allowed them to take care of their loved ones. Many were grandchildren taking care of their grandparents. Many, again, this is the 6 years I served in the state legislatures. The first 2 years I met with many of them. They were really organizing around this before, to be honest, before the union and others were broken up, because there was pushback against, obviously corporate interests that did not want to see people moving away from nursing homes and moving away from facilities that, created a revenue stream for them. And so I really, truly believe that it's up to us what that model looks like. But it can be family members, it can be people of your choosing, but at the same time, we need to be able to provide for that caregiver, no matter who it is. And it was wonderful because they got access to training, specific training through the state. And it was really pushed for within the agreement with the union. And it wasn't just you're going to come and care. We're going to actually teach you CPR. We're going to teach you all these other processes to make sure that you are qualified to take care of your loved ones. So it's an option, Chris. Like, we can actually have this be part of the plan.
Excellent. Yeah, I mean, it's spot on. And Henrietta, please.
Just like the Congresswoman said, when you talk about the professionalism of this workforce, you're talking about people who, in the beginning, we were just doing like the basic daily needs of our parents, and we stayed home, and that money was not a livable wage. So we have to think about, if there are people who are staying home to provide care to a family member, where does the livable for the person who's caring for you come from, right? So now that we have this shortage, because now we're seeing that this is a professional workforce, and now we have to include the livable wages, the benefits, the unions, the right to form a union, and all these things that come with a person who chooses this workforce. I myself, when I chose to become a home care worker, like a lot of these panelists, I was, already working in the healthcare field. So I had to stop and come out of that job that was well-paying and gave me benefits to take care of my ailing grandmother. So when I decided to choose that field of work, I became part of the working poor. So as we look at this professionalism, we have to include livable wages, benefits, unionized jobs, and we have to also understand that this is the profession that's very much needed. It is the core. It is the core of our society right now.
Question on this side? All right. She was my hype woman, by the way. So she can talk as long as she wants.
Hi, Cassandra Walker of Highland Park and West Side Mothers. And Selma told me to tell you, Tlaib, hello. Well, at West Side Mothers, what we do is we help people that have problems with the Department of Human Services. And I have recently started seeing members coming in who are having problems getting health care. I have a gentleman who has gotten his, the red and blue card, as he say, but he's got to have a lung transplant. He's got to get extra coverage. When he applied for it, they denied him, claiming that he makes too much. He only gets $14,000 a year. They say he makes too much. But the insurance and the doctors are telling him he's got to have extra coverage. He's got to have another point of coverage in order for them to do his lung surgery. Then when it comes to the chore providing service, I had a woman come in. We went to a hearing on the matter because the doctor didn't specify or circle the thing that she needed, because she's on oxygen, so she's exhausted when it comes to doing certain things, well, doing moving, I guess, really. And they denied her the services. So now we've got to go and reapply for the services. But not only are they not paying the people well, but they're also denying the people the services that they need, even when the doctors specify that they need the help.
Wow.
So I do want to emphasize this, and this is something that people, maybe raise your hand if you understand what I mean. Coverage doesn't mean you're saved. Does that mean when you want to, so there's always this movement by Congress before I got there of let's just cover more people. but realizing the coverage is actually lower. I mean, it is. It's less than. You're actually paying more out of your pocket. I mean, when we passed the Affordable Care Act, of course it was great, but it wasn't perfect because guess what? Private healthcare companies are now making record profits. They've not made this amount of money ever. And so I want you to know, yeah, we covered 25% more of our neighbors. And yes, it did save lives. We have to admit that it has. But we are hearing stories like this. I hear so many stories of not only the copay, the deductible. It is such a cycle of poverty. I mean, many of my folks are paying deductibles as if they were mortgages. That's why some of them can't even go out and buy their own homes. We're seeing less and less home ownership in communities, especially communities of color, because of the high rise of cost of health care.
So would Medicare for All essentially, if you are sick and you need a service, a medical service, you'll automatically get it, right? Is that how it works? Or do you have to call and say, hey, or is it up to the doctor to say, hey, if you need a new lung, we got to get you a new lung? Or is there going to be another bureaucrat to kind of deal with that? Do you know that?
You oversimplify it in some way, but Medicare, well, it's true, because Medicare is going to cover more people, but it actually gets rid of, co-pays, deductibles, and so forth. It's a single-payer system. And yes, it would transition away from these kinds of healthcare plans that basically do become a challenge and issue for people to survive and live from. Many people currently now, just the bare access to like long-term care actually prevents them from living longer because they just don't have access to it because Medicare doesn't cover it right now. There's also pushback, obviously in Medicare for All, no more deductibles, no more premiums that we have to pay, any of those things. It would a system basically of expanding what we currently have, but much, again, closer to more of a single payer system, right? And more closer to universal health care. I can tell you that I don't think anything is going to be perfect. But I just know that one of the things I ask my colleagues to recognize is it is broken still. It is very broken. And until we not allow, corporate entities, the healthcare system to help write these bills, that it is going to continue to create these loopholes, that is going to continue to create more of a for-profit system for healthcare in our country versus us trying to circumvent that and say, no, it has to be healthcare, humane healthcare for our residents first, period. And when we do that, it does mean that it won't be profit-driven anymore. And that, as I know, probably would include your friend who has a lung transplant, that person would probably right now under Medicare for All be covered because it won't be based on his current coverage, but based on a much more expanded coverage that would not require, I think, some of the bureaucracy, some of the red tape that he has to go through now.
So the government is not looking to make money from the system, just to be clear. So it's not a profit-driven.
Well, what I mean right now is many of our private healthcare systems, like right now, many people go on the exchange and go and get, through the Affordable Care Act. Many people right now, either it's through that or through their private employer. All of those systems right now are not. I mean, I have people working for the big three and are still right now working like literally. Income-wise, when it comes to how much they're taking out of their pockets for healthcare, they're still in the working poor, working low-income, basically in that income level. What I'm saying is, I wouldn't say that. It's over some. I don't know what to call it, though, Abe. But Medicare for All is expanding what we have for Medicare now, but for more people. It takes away the age requirement, right? It takes away, also it talks about specifically being able to do what we've been able to do with prescription drugs for, to be able to do the bidding, just similar to what we do for veterans, so that people can have access to prescription drugs that they don't have access to now. Again, all of those systems that are in place now that has been able to provide for folks are now driven by private health plans that are just not working for our residents anymore.
At one point, I lived in Galt, Ontario, in Canada,
Yeah.
and I got sick. I went to the hospital, I got service, it wasn't a long time, and I never received a bill. It does work.
Hi.
Hi. I don't have a question. My name is Laura. I don't have a question. I just wanted to piggyback on what the Congresswoman said. I work for a financial services company, and everybody I work with, they all have boats and they go to Europe and stuff, and I'm the receptionist, and I am making less than I've ever made in this industry. I've been in this industry since 1978. I get 5 days off a year, and I buy insurance for me and my adult children. It's a third of my salary, a third. And right now I'm supposed to be getting some tests, I'm supposed to be getting a mammogram, yada, yada, yada. I know what that's gonna cost. I know what those tests are gonna cost, and I'm putting them off because, I mean, so yeah, working poor, it's a real thing. When I hear that people don't have health care, it really breaks my heart, but I do have health care, and it's killing me. I can't move out of where I am. So anyway, sorry.
Thank you for sharing that story. Got a question in the back? Oh, okay. I want to emphasize, so I'll let you go, but if we can please, if you do have a question, we want to prioritize those because we want to make sure we take advantage of this panel and their experience and their expertise. So here you go.
I just wanted to say I'm a retiree from Local 22 from the UAW. I retired in 2004. And when I retired, I thought I was going to live a life of yeah. Well, it turned into a nightmare because of health care. I had to really think about what was going on, and it was a group of us got together as retirees and started saying something is really wrong here. And we started looking at a program which was called Single Payer, and we started pushing the UAW and everybody else and trying to give as much information as we could to understand this is what we need. Even as a retiree with the so-called Cadillac plan, co-pays and deductibles kill you, and you on a fixed income. Your money don't increase every month. So if you get a bill for $400 this month, $500 next month, you figuring out, well, where's the food coming from? You know, you cannot do it. So even the best plans do not work. And single payer is the only way. And everybody in, nobody out, no co-pays, no deductible, and it takes the profit out of it. And that's the real issue. These companies are making profit off of us. They always have been. So we've got to convince people that this is the only way. Take the profit out. Let's take care of people. And it's just, well, I guess I need to shut up.
No, she's right, right? I think the question becomes, at what point do we say making profit off me getting sick is no longer morally acceptable? And the economy, or the numbers show, folks would rather say, I'd have a marginal increase in my taxes and never have to worry about a bill from BCBS or HAP or any company ever again, if it just means every year when I pay my taxes, this is just included. And that you no longer have to make that decision of, man, I'm not feeling well. Do I go to the doctor? Oh, is it worth $50 today? I don't think so, right? So these are the questions, I mean, these evil decisions people are making. This is the system that's going to try to eliminate that. And then the other part of this, you know, today, so we all know that it makes sense. But the other question about, you know, the caring economy, right? How do we envision an economy that is really holistic in its approach of caring for people that need it and making sure that those who are doing the care also are thought of when we build that process. So any questions from this side? I'll take one from the back.
I'll make it quick. I seen you looking at your watch. Yes, my name is Lauren McGee, and basically I just want to know, is the system completely broke? Because back in 2011, April the 1st, I had a kidney transplant. And it seemed to be pretty smooth. I had no out-of-pocket costs, and I had my, I'm a UAW member too, Local 174, but I had my employer's insurance, and then the biggest problem I basically had was receiving 60% of my pay when your bills come in at 100%. I was just wondering, I didn't find the system, I'm not defending the system because I know other people have problems too, but it seemed to go pretty smooth for me. I was just wondering, do we have to...
I think it would continue to be smooth for you with Medicare for All, except you won't be having to pay any out-of-pocket cost. You know, a lot of the things that you might not be seeing regarding cost is being charged towards your paycheck. Just, take a closer look. But also, you having access to humane healthcare system shouldn't be based and attached to your employer. And that's something that I want to emphasize. Because, sir, next day you could lose your employment. Something could happen. And again, you should be able to still have that procedure done without ever having to worry about that.
Okay. And another thing, FMLA. Now, I thought that was mandated by the government. If you had a certain amount of employees, you were granted FMLA. If an employer had 50 or less employees, they didn't offer FMLA. But if you have X amount of employees, then you would have FMLA. Is that correct?
Yeah, so the majority of your neighbors do not have access to FMLA through their employment. I can't remember the statistic that I gave just today, but there are specific folks that are not going to have access. I think it's close to 60% of low-income fathers. It looks like even 1/4 of moms go back to work within 2 weeks. Again, not everybody's going to have access to FMLA. By the way, it's not like I don't know if you've ever tried it. It is the 6 weeks is the kind of the standard that you hear. But it is not extended to, the other parent in some cases, again, because maybe they're not, their employer doesn't allow it. But yeah, the majority don't think that it's all in. If you got a job that it's part of the package, it isn't. And so paid sick leave in Michigan specifically has been one of the #1 issues that I've been hearing from folks that are in the service industry. Majority of my residents in 13th Congressional District, which is 12 communities within Wayne County, if I'm in Inkster to Redford Township to even Romulus, majority of the people I'm encountering when I'm talking to them don't have access to FMLA. But they are working, and they're in the front lines of actually, we probably touch those workers more than you realize, not only through restaurants and those, but these are folks that are, again, low-end jobs. Many even work at the airport and other places that don't have access to FMLA.
Take one up there.
My name is Adam Janwer. Thank you for being here, and thank you all the panelists for your stories. I have a pre-existing condition. I used Obamacare for a year to insure myself while I was starting a company, and I am in favor of Medicare for All in theory. And my question is about a concern about in practice it's going to be 100 or 1,000 pages long law. So how can we be sure that it's going to be implemented well? And if possible, are there a couple small examples that are concrete and understandable that other countries maybe do to implement it well, or maybe implement it poorly that we could avoid the examples that they set? Yeah, that's my question. Thanks.
Yeah. No, and I want you all to know it is our responsibility to continue to fight, because even if we pass Medicare for All tomorrow, we have to ensure that it's being implemented, because the various policies implemented the right way, because the various policies, I'm telling you, even if we pass legislation today, it depends on who's the administration. I mean, pretend he's not there, pretend it's a different administration, but they're going to be the ones have to implement it. And so even though the legislative intent will be there, the actual in practice on the ground is going to depend on us demanding that it happens in a certain way. I think taking out the corporate greed, taking out the profit-driven is going to give us more leverage for our families in some ways, at least for us to have a really thoughtful conversation without the other side, the private healthcare system, trying to gaslight us to believe this is not working, there are going to be long lines, all these other things. But it is our responsibility. I'll give you an example. We passed the Clean Air Act. This was massive transformation of how we treated our air in our country. You know it's not working anymore, right? The permission to pollute is not working anymore. Actually, has made it in some sort of ways because one, I don't think we emphasize the administrator in the way they did it to be enforceable in a way that they have it now. Currently, I have corporate polluters that will release 700, and this is a true story, 725% more beyond their permit. They get 21 days to adjust it. Maybe they get Department of Justice to come slap them on the hand and say, you got to do this or that. The point is, it is our responsibility to make sure that it is done in the right way. And it will require changes here and there and as time goes on, but it is our responsibility to, one, recognize we have a duty to hold everybody accountable how it's implemented, but if we can all agree that it's inefficient now and that this gets us closer to elite access and people being able to afford it finally, you know, again, I think that at least opens the door, right, to us having a real seat at the table, y'all. Like, everything in the past, I really didn't feel like, and I was a current state rep when this all happened, I mean, didn't really truly feel like we had a seat at the table at the time because private healthcare systems were at the table demanding certain things that I think really deteriorated any way to really truly have a humane healthcare system through the Affordable Care Act.
Questions or comments?
A lot of work to do. Yeah.
Thank you. So good evening, everyone. I am Anistia Thomas. I am a community leader in addition to also the new Counting Committee Chair for the Highland Park Census for 2020, which is part of the reason why I'm here today is to offer support for these initiatives. But I'm also an entrepreneur. And so with that being said, I have a 10-month-old that I had as a single mom, and as soon as I had him, I went back to work the next day. And I have not had a break since. Within the same week, my father had a series of 3 strokes and became totally disabled. And because my parents, both of them, did not have, they were never employed as far as another employer, but they were self-employed, they barely even get Social Security. So I looked into adult care. Couldn't afford that. It was way above. So now my parents live with me full time, and I'm taking care of both my parents and my son alone. And so my question is, and I'm not even able to afford daycare. So right now I'm actually taking time off from work and actually watching my dad and helping to care for him by him being completely disabled, but also caring for my son. And when I do go into my office, my son is at work with me. But my question is more specifically is, how do we start mobilizing and fixing, looking at solutions for affordable daycare and also home adult care in these types of instances?
You know, we have to just, it's an understanding and a recognition that we have to make them priority first. Until we make them a priority, then we'll find the money for it, right? Like every time people say we can't do it because I said no, but if we prioritize and say, look, children and families have to come first, or our seasoned residents have to come first, our sick have to come first. If we do that, because even going recently seeing the massive difference between what we fund in defense funding versus our human and health services is outstanding. Like people are like, why didn't you vote for that? It's like $733 billion for defense, while, you know, I have the 3rd poorest congressional district. We can't even get clean drinking water in our schools. And so, and until there's a truly an audit, I think, in seeing the discrepancy of what we prioritize before we actually put our people first. I mean, the deterioration, I think, in supporting our families, the systems that really are required to be put in place are just dwindling. It's those that have versus those that don't. And even when we try, you starting your own business, really wanting to try, but you also want to become a mother and you want to be a good daughter and take care of your family, you should have the support system to do that. We're all good intended people that want to take care of our families, and we should have those support networks. Majority of Americans believe in it. Majority of Americans believe these are the things that should be prioritized and should be funded. And
you know, folks think these are too bold. And I always give them this story about Congresswoman Shirley Chisholm, who, you know, said, look, we have to feed children in schools because if we don't, you know, they're not going to learn. Children that are hungry cannot learn. And she persisted, right? And we got free lunches for kids in schools. And we can't even imagine not having free lunches for kids in schools today. They get fed twice, in the morning and then now we got to work on the quality, because implementation is important, because the quality is getting worse, folks. I thought it was bad when I was a kid, but it's getting worse. But the point is, we have a responsibility, I think, to recognizing there's a crisis, and child care is a crisis, paid sick leave is a crisis, health care is a crisis, and until we do that, we're never going to be able to resolve it. I love also, and this is a really good story, so March Reading Month, I have a lot of schools, so we end up going into April and so forth. I'll go into 2nd and 3rd grade classes. You know, I'll read Grace for President, of course. The kids get excited about that. And I show them where I work. It's the last page. Or I'll read Legend of Mackinac Island or anything. You know, and when I'm done, I always ask the kids, you know, do you know what a member of Congress do? And some will, you know, they'll mention the president or they'll mention Washington, D.C. or something. And then I'll ask also, you know, well, how many of you have asthma? And a third of the class will raise their hand. I don't care where I'm at. A third of the class will raise their hand. I have, again, all of Wayne County, which right now is not complying with sulfur dioxide standards for the federal government. And I tell them, you know, one of the things I work on is making sure we have clean air, because it's not like we can eject clean air out. Like, it's not like we can take the air and put it back out there. We maybe can do that with water. And I tell the kids, you know, when I was your age, we used to go to restaurants all the time. And you know how you go with your parents and they all nod their heads and they're like, you know, they'll ask you, well, how many people in your party? I said, well, you know what they used to ask me when I was a little girl? My parents, they asked me, smoking or non-smoking section. The kids are like, what? I said, they used to smoke at restaurants. They're like, nuh-uh. I was like, airplanes. They're like, no way. And I was like, hospitals. What? And I said, guess what? We at that time, years before, knew secondhand smoking was killing people. That it was worse than actually smoking cigarettes. But what? Corporations gaslighted us, made us believe that's going to be possible. We can't do this. Businesses are going to shut down. The casinos are going to go out of business. We could still make them smoking ban, by the way. All this stuff. They're like, oh my God, it's going to be awful. No. Can you now imagine not having the smoking ban in the state of Michigan or even around the country? I mean, so I always tell the kids, those are the bold ideas. Right now, you all know, because you have asthma, how many of you, it's so bad outside you can't even go to school, you have an asthma attack. They'll raise their hand. We got to do something about these kinds of crises. And so I tell you all these stories because it is going to be a hard fight. It's going to take us a while to get this win, but we're going to win. And we're going to hold any administration accountable to it.
So we're incredibly lucky to have Rashida in Congress really fighting and pushing forward these issues. But what I think is even more incredible is we have folks on the ground right now fighting to make sure that situations like you're in, where you have a 10-month-old child and you have a dad with a disability, that we can take care of them. And folks on the panel, so how many of you guys know what the Caring Majority Coalition is? All right, so for the rest of you that are not, the Caring Majority Coalition is a group of organizers who are fighting to make sure that the federal government and the state government here in Michigan are going to do the research, are going to do the investment to look at how we actually address this issue. Because this is a crisis, as the Congresswoman said. So we have folks from Mothering Justice and we have folks from Michigan United who are at the forefront of this Caring Majority Coalition. So if one representative from each of that can just quickly speak up on what the work is you're doing and how people in this crowd can get involved in that Caring Majority Coalition work. So, any of our panelists?
Well, for the Caring Majority on our end, when we're doing Caring Majority across the across the care. What we're doing as a team of people, we are formulating panels and board members who are going up to Lansing speaking and having conversations with legislators about the Medicare expansion. So people in the state of Michigan who have children that needs these extra dollars so you can continue to work, so you can pay someone to come in who's qualified, who's certified to care for your loved ones. This is what we're trying to bring to their attention. And like I said, we're fighting hard, we're talking hard, and we're not going to give up. We're going to keep letting them know how important that it is for us to have this money, have this program expanded, to have these dollars put in place to make sure that the money is there to pay people for your behalf. And so this is what we're doing with the care majority.
And
on behalf of Michigan United and the care majority, we're holding listening sessions for people to share their stories. We're focusing on the 2020 election, and we want to ask those candidates, what is your platform? Are you going to stand with us? Specific questions of what we're not getting now and how can you help move it along. And so this is going on, it's been going on, we had our kickoff in June. And so we're gonna do this all the way up until September. And if you wanna get involved, you definitely are invited to come out, share your story. We have conference calls where you can join in, listen to what we're talking about. We also have an exhibit that Empire Alliance has taken 30 home care workers that shared their story, which Dr. Loves of Michigan State is putting together to have a traveling exhibit of women and men who have shared their stories about what home care workers go through daily. And the struggles is hard. So definitely get involved. I mean, it's room to share. I mean, it's not just home care workers. This is for everybody. This is the community as a whole to share your personal story, be specific with these candidates, and elect the candidate that's going to take care of our issues.
Again, good afternoon, everybody. Mother and Justice is fired up, and we're ready. On August 24th, we'll be showing out and showing out on August 24th at Mary Grove College at 9 a.m. to 4. We are doing our Mother Summit. We are bringing everybody out to come out, talk about, and come up with our solution. We also talking about paid sick leave. And not just paid sick leave, but affordable child care. So we are stepping up, we are stepping out, and we're going to have a voice on August 24th. Again, mark your calendars. Come out, support us, and not just support us, tell a friend and bring a friend. So that's what Mother and Justice are doing. And you want to give anything out?
Well, I mean, I can just say I'm still fairly new to working with Mother and Justice, but what I can say is my introduction to what they do came from what's called a mama conversation, and it was just an invitation to come discuss a particular issue. In my case, it was to discuss SNAP benefits, which is a food access issue, and so that conversation was enough to enlighten me about the other work that they do in terms of training mothers, in terms of educating, in terms of mobilizing, and it was enough for me to say, I want to go further and see what I can do to help contribute to that work. And here we are.
Wow.
And one more thing.
So if I may ask a follow-up to the mother. So do you have to be a mother to come to the mother conference on August 24th?
Yes, on August 24th. And one more thing, check us out on Facebook. We are on Facebook, Twitter. Come on out, and we also host in our communities. Like we standing up now, going to blocks and saying, hey, Mother and Justice is not backing down, and we are coming to Washington, D.C. very soon. So we're not backing down.
So do you have to be a mother?
Washington, D.C. already. No, you guys got Senator Kamala Harris to come. Congresswoman, I think, Deb Haaland and others to talk about the Mama's agenda, especially around supporting women of color and so forth. But no, they have a strong presence, I think, already in Washington, D.C., for sure.
All right. Well, thank you, Mothering Justice, for uplifting the incredible work you're doing. Remember, August 24th from 9 to 4 at Mary Grove College. And it's completely free, and you don't have to be a mother, I believe. If you're an ally, you can come. I'm certainly not a mother, and I will be there. So I expect all of you to show up to the Mama Conference. Is it called the Mama or the Mother Conference? Which? The Mama Summit.
The Mama Summit.
The Mama Summit, all right. So we're going to take several more questions. I'm going to go 2 from this side and 2 from that side. So anyone have questions? I believe she approached so quickly.
Sure. My name is Marcina Cole, and Rashid, I'm very concerned about what's going on in Capitol Hill with the current administration, where they're chiseling very slowly the Affordable Care Act that's causing millions of people, probably 30 million people. They said 20 million, I believe, in this past February 2019, that people had lost their insurance. And now the federal court judge in Texas basically saying the Affordable Care Act is unconstitutional. So they're working to, the current administration and the federal court judges across the nation and various states are working to eliminate Affordable Care Act, which leaves a lot of people that's sick, seriously ill, unable to be treated for their illnesses, uninsured, and no insurance whatsoever. I don't know what the Democratic Party, as far as the legislators that's involved, that's in the U.S. Senate, I don't know what they plan to do, but we need to work a lot harder to make sure that each and every one in this country will have health insurance, like other places abroad who have insurance for all, dental insurance. People are dying, and on that note, I want to say September the 14th, I'm having a medical forum dealing with the disparity of people of color who aren't getting the insurance that they need, the care that they need, because my son is dead right now because of what happened to him at a hospital and clinic. But just keep in mind, it's all about saving lives. That's right. We need to come together and not be separate. No matter how many organizations are out here, we need to come together. It's too many organizations want to do their thing. I'm asking for you all to come to Hartford Church September the 14th, dealing with Reclaim Your Right to Health. Thank you so much.
Thank you.
So I will come back to this side, I promise. We do have a Spanish speaker who wants to ask a question. So I'm going to have her ask her question in Spanish. We do have a translator who will translate the question. So we'll start off. Tell us your name.
Rosa.
Rosa, all right.
Buenas tardes. Mi pregunta es, mi mamá tiene diabetes, ya tiene 60 años y tiene el Medicaid de emergencia. La insulina es muy cara y a veces llora porque su insulina le sube 300, 400 y con la insulina le baja, pero tiene muchos problemas por lo mismo, ¿verdad? Y no le pueden dar Medicaid, Straight Medicaid porque no tiene papeles. Gracias.
So she was saying that her mother is diabetic. She's an undocumented immigrant and only has emergency Medicaid because she's undocumented. And emergency Medicaid does not cover her insulin, so she has to pay out of pocket, which is very expensive, and sometimes she cries because her sugar is out of control and she cannot afford to pay for insulin. And the question is if this bill that is being drafted will cover women like her mother and other undocumented immigrants that have diabetes and other health problems.
So, unfortunately, we do have a broken immigration system where we have neighbors right now that it is impossible for them to get in any line. There is no line, folks. I was an immigration lawyer for a couple of years, and I would have the same cases, same circumstances, and at the end, it's completely different outcomes.
we need to fix our immigration system, because someone like your mother will still not have access to health care until we can create a pathway for citizenship, especially if many of them, again, have relatives that are U.S. citizens that could apply for them, but they can't adjust their status here. We have children that literally this is all they know is our country, and they need to have access to a pathway to citizenship. But I can tell you there are extremely generous people that will may be able to help your mother, and we can be able to reach out to them. These are private individuals that may be able to help you get the care that you need. But I think all of us in this room, we need to understand, yes, we talk about a humane healthcare system, but I can tell you, I just came from Calhoun County yesterday. Our immigration system is so deteriorated. We are violating international human rights. This woman who is claiming to be a United States citizen literally is slept on the floor for 3 days next to a toilet. It was an overcrowded cell right here in Michigan. We have a huge crisis in regards to our immigration system. And let me tell you, more enforcement is not fixing it. It needs to stop. We need a pathway, especially so many of our neighbors are married to U.S. citizens or have a green card holder family member. I hear about them all the time. We have children that are literally, we're not able to get into the pathway because of some mix-up, because they didn't have the right lawyer, because these are our legal documents that, again, when they get in line, they think, okay, well, I'm like, there is no line. They're like, you're right. I'm like, you shouldn't have to wait years to get in front of an immigration judge. You shouldn't have to wait 20 years. I had no cases of 20 years before you can be reunited with your U.S. citizen brother or sister. That is the reality, is that we have a system that hasn't had an overhaul. They just want a lazy approach. They want to dehumanize, and it's gotten worse with this administration. It's gotten worse with the leadership here. And instead, they created ICE. ICE did not make us safer. It wasn't existing in 2001, and let me tell you, creating checkpoints in Southwest Detroit on Michigan Avenue, doing ICE operations in front of schools, which is against their own rules, they're rogue. They need to be pulled back, completely abolished. We do not need another layer of militarization of our communities. Focus on the fact that we do have a system. And let me tell you, I've talked to agents, Border Patrol, field agents, ICE agents. So many of them, I will ask, system is broken. They're like, absolutely. Absolutely. Many of them tell me, we were not hired. We weren't trained to deal with this kind of a deterioration of a system. And throwing money at it is not going to fix it. Creating more enforcement mechanisms is not going to fix it. These are millions and millions of folks. And let me tell you, the people that benefit the most by our broken immigration system are the same people that benefit the most from our healthcare system that's broken. They make money off of workers under their shadow. They make money off of the fact that even Henry Ford used to go to the border and be like, come on, I need to get you, come here. And again, it never matched up to the demands for our country. But more importantly, this is something that we all need to realize is so interconnected. But yesterday, talking to 4 individuals in Calhoun County, I realized just how dehumanizing it's become, and just unbearable that I felt so exhausted leaving there, hearing from a woman who was trafficked between the age of 10 and 12, a survivor of human trafficking, held in detention, crying in tears, being separated from her 6-year-old daughter. It's broken. And until we can fix it, we'll never be able to take care of someone like her mother. So please, as you talk about this, don't let them make our immigrants look like they're ugly, they're criminals. Don't let them do that. This is a system, honestly, if we don't overhaul it, you're going to see literally neighborhoods like the one I grew up in completely turned into just complete chaos, because they've been so much integral part of our neighborhoods and our communities. So I really do appreciate your courage for speaking up. And please come and talk to me afterwards, and I will try my best to find someone that will privately help your mother get access to her insulin.
Okay, well, I feel like this is the best time for me to ask this question because I don't know when we'll see each other again. So, Oh, so you be here a lot? Okay.
Every week.
I have 2 questions. Is that okay? Yes. Okay. The first question I want to ask, how do you feel about mass incarceration, especially on people of color? Have that been brought up to Congress to slow down mass incarceration? Like you just said, people get detained from being from another country. I know so many people detained for senseless things that, you know, I feel like really wasn't worth it, or placed in this virtual world of not being able to get health care, affordable housing, you know. So I wonder, is the Congress working on that? Do you know?
So I can tell you I'm very much against and have supported initiatives that completely get private, no more private prisons in our country. It should not be a for-profit scheme. And the same people detaining immigrants at the border, the same people that are incarcerating folks at Calhoun County are the same broken system of mass incarceration. And we saw it yesterday, my team and I, in Calhoun County. But the same for-profit entities are the ones benefiting the most from mass incarceration. But I can tell you this. You know, when folks tell me about facial recognition in downtown Detroit and all over the neighborhoods, you know, they want to surveillance us more. Like, that's what, by the way, facial recognition is flawed. It is. It's flawed. It is. We introduced a ban on facial recognition, no federal funding for that. Instead of using this money for these for-profit companies that are coming to test this stuff in our communities of color, that's exactly what they're doing. By the way, 40 to 60% error rates, facial recognition of people of color, especially women, African-American women. Know this, your Facebook photo, your DMV record, all of it into this bad database that is a for-profit entity is coming and saying to the city of Detroit right now, currently, come over here. We want to put this in and we're going to help decrease crime. Guess what? Even the green light program in Detroit has not decreased crime. Instead of spending money that should be going to transportation on those cameras and those products, and by the way, it's not just cameras, folks. It's a system that is overly criminalizing people. And the most important also, all of that, if you look at the money, no, seriously, but if you look at the money, why aren't we spending it on education and housing and like, absolutely. So don't you ever, and trust me, they have the authority. This is not money that they're saying, here, spend it on facial. No, you made a choice, a conscious choice, to use a broken surveillance system that basically creates this national database that's going to misidentify people, that is going to surveillance people. Instead, why did you spend the money in actually trying to go into schools and to talk to kids about, how about this? How about stop allowing children, literally, drinking lead-infested water? Yeah, maybe then they can actually learn in school. You know, how can they learn if they're literally getting poisoned? So I can tell you that I'm very much understanding the intersectionality, though. When I talk, but you know, I tell you right now, every time I talk to immigrant rights groups, they are now starting to wake up. This has been the last maybe few years. They don't talk about fixing our immigration system without talking about mass incarceration, because the same people that profit off of it are the same people that profit off of the broken immigration system. So just know all of it's driven by this corporate greed, corporate assault on working families. They're not putting facial recognition in Oakland County or anywhere else. They're not. And they're making money. They're making money. You don't see them building new jails out there. So just know this. I'm going to continue fighting, not only increasing access to home ownership, but also pushing back against the use of credit scores for auto insurance, for, honest to God, they use it for employment, they use it for everything. All of that was not what it was intended to be used for. And now, even folks, I know you probably don't agree, you want to be a police officer. He has a DTE bill on his report, but he's one of us. Yeah. He wanted to be, you know, pass the test. He couldn't become a police officer because something on his credit report. How is that even allowed? All of these systems and barriers focus on helping people versus incarcerating them. It's just
unbelievably inhumane, but also unjust for our communities. That's why we're never going to be able to get out of this rut, because they come to us and they gaslight us to believe that they put the stupid green light and a camera on a corner, that somehow it's going to save us. Guess what? It's not saving us. So don't you dare support this over-criminalization of our people or surveillance of our people. It's not working. How about some difference? How about fixing 36th District Court? So my folks, how about that? How about actual, no, really, this is what they need to be spending money on, not things that overly criminalize our people.
Thank you, thank you, thank you, thank you. Can I ask my second question? We actually kind of.
Can we just take 2 more questions from the crowd, and then we'll bounce it back to you? So I'll take 2 more questions from this side, then the Congresswoman will give her closing remarks. Ma'am?
Hey, Congresswoman.
I
And
love
where's that money for that
she
new
gives the
jail?
best hugs, by the way.
Where's the money for the new jail? And where's the person that took all the money from the city of Detroit for that new jail, and it's a hole in the ground like a meteorite done hit it? Who is being held accountable for that? See, questions like that, people, she can't do it by herself. This Obamacare and this Obamacare or ACA, whatever you want to call it, way before she got in there, what she's talking about, Obama tried to do that, the Single Payer Act. And you got people that was in there decimating it as they speak, Democrats and Republicans. Okay, let's not get that twisted, number one. Number two, what they're offering is a little bit better, but at the same time, you're still going to have to hold your people accountable, meaning that you're going to have to get out here and vote. She can't do it by herself. She can't do it by herself. The one thing this administration got us doing is admitting the fact that it's in your face. You can't no longer be a lie no more. It's not in your mind. It's not an infatuation. It's a demonstration of truth that was there all along. Y'all just woke up. I've been woke. I commend you, Mother. I had 4 sons. They all went to college, graduated. I can commend you, Mother, because the FMLA, yeah, it's broken. Yes, I had approximately 17 surgeries. I have a bone disorder. My husband could no longer work, so I had to work in the ED for 25 years. The FMLA that I went on, I used it up to the point where I didn't invest it anymore. So I had to go into my personal bank, to the point where it would strike against me. When I signed up for the COBRA, instead, my husband wasn't working anymore. I had to support my whole entire family, which was $500 a month. And I'm only getting 66.6% of the long-term disability, or short-term disability at the time. So I understand your plight. And I understand you, Mother, with a wonderful gentleman that's sitting next to you being all proud black man. You go for what's yours, brother. Never, ever let them know or tell you what your worth is. Know your worth. Play the game. Know your role. Stay in it and do it well. And that woman will die a happy woman, proud and true.
Amen to that. Thank you.
I love the health profession. I've been in the health profession for years. I'm a person that believes in 150% patient quality care.
That's right.
You have to understand, educating some of these young folk now that they put out there that nurses makes far much more money. You're getting students that's making a check than compassion. And what we need to do is remove the word customers and put patient first. So therefore, you will get quality care. I lost my mama the 25th of this year. And the fact that she had COPD, she had congestive heart failure, and she was well over 500-some-odd pounds. But see, I had to be there because I knew exactly what was going on in the medical field. You're not going to treat my mother any kind of way. You can't say anything to me, and don't take me in no quiet room because you have put a limitation on her insurance. You know exactly how much she's going to spend. I know that. So I understand the plight, but we need to get better education, but we have to take initiative and be proactive and get out there and get the information and vetting people and vote. Vote often. vote locally, vote statewide, vote every day, vote every other day, vote on holidays, vote on your birthday, vote on your break, vote when you get up, vote when you sit down, vote.
All right. I would drop the mic, but it's not mine. The folks at C-SPAN wouldn't be too happy with that. All right, I'll take one more question on this side. All right, and then we're going to pass it back to the Congresswoman. So, gosh, I said on this side, but I will do two more on this side. And then we really have to wrap up because we want to respect everyone's time. We did say the event was going to end at 8, so we have 7 minutes to crunch. 3 questions. So.
Just a quick question. In respect to all of the healthcare things, I've been in the field for over 30 years, and I've worked with every possible field, every possible area of healthcare, including insurance and managed care years ago. But in assisting patients and clients with trying to navigate healthcare and DHS and everything else, and all the changes that are coming down the tubes now, one of the biggest issues that has come across my desk and come across everything is working with people who have chronic life-threatening illness, things like ESRD, end-stage renal disease, who may have Medicare Advantage plans. They won't cover that unless they have it prior to getting diagnosed. Or those who don't have Medicare, they have straight Medicare, A and B, and they don't have a secondary plan except for Medicaid, and they end up with the wonderful spend downs.
I hate spend downs.
Oh yeah, I don't understand how somebody making $1,400 in the entire household.
It all started with this thing about skin in the game.
Well, this is it.
No, they politicized it, and spend down has been one of the biggest barriers for my residents, seasoned residents. It's one of the worst process. It's awful.
How can you give a $1,000 spend down to someone who's making $1,400 a month? And that starts over every month. I mean, this is life-threatening procedures they need.
I know.
So I spend my day trying to negotiate things with providers, getting things done for them. But we're talking about, I'm all in favor of Medicare for all. The big problem is we're in a capitalistic society, and we are going to have to change and really fight for change to get people to understand we're talking about people. We're not talking about case numbers, diagnosis codes, billing codes, CPT codes, any of that. Enough of the percentage crap. We're talking human bodies, human feelings, and life or death sentences here. Yeah. And that's going to be a tough change when we're talking with people who are just used to their bottom line. So we're really going to have to fight hard.
Yeah.
All right, I promise 2 more. Take one in the front and then one in the back. So she's screaming at me from across. So.
Hello, everybody. Good evening. I want to say, oh, hey, girl. So anyway, I went through a lot. I was deaf on, well, both sides. Only one ear I can really, and I caught hell trying to get a hearing aid. And it's been a lot. And I fight it. And the insurance I got, I have Molina. They fight it for me. And from the grace of God, they got that hearing aid for me. They got that hearing aid. It took me a while because I've had a hard time hearing. I was getting frustrated. people be talking to me, I just, like, I'm really listening to them and I don't hear nothing. But it's hard to see people say, how you get your hearing aid? I said, my insurance fighting for me. That's how I got it. They've been trying to get, people be trying to get hearing aids and stuff, and they can't hear at all. And I feel so bad for them because I know what they're going through, because I went through the same thing. But I know it's a God that will help these people and go help all of us get what we need. And it's coming.
So, Congresswoman, the plan that you're fighting for, the Medicare for All, does that include hearing aids and all that?
I believe it does. It's one of the things that we talked about right away is the coverage of hearing aids. Yeah, absolutely.
All right. So I have one more question, and then we're wrapping up. I'm sorry if I didn't get to you. If you can nab the Congresswoman before she goes, good luck. But we're going to have him ask his question.
My name is Bob Sisler, and I'm a clinical social worker. I've worked in healthcare all my life. My question is this. We are a country of laws. And in this state, we used to have only 2 insurance companies. One was Aetna and one was Blue Cross Blue Shield. The law was very clear. They were for nonprofit. And we had health care that was given to people. We had health care that was considered public health. And therefore, people got services. We've allowed this state and this country to change the laws to a for-profit system. How do we get people to recognize that and to get so pissed off that we close every airport in this country like Hong Kong has? Because they should be pissed off that they're being killed by these for-profit systems. How do we do that?
I mean, I could tell you that for me, seeing somebody even like me getting elected, I mean, it was, people really need to try to believe in the impossible, right? Right now, you all think it must be impossible. It isn't. And it may not require like closing the airport, but yeah, things like that are important to elevate the voice and to demand that the truth gets out, because that's what gets muffled is the truth. The misinformation even out there about Medicare for All, I can't even keep track about the continued misleading information, intentional misleading information about Medicare for All, even intentional misleading information about paid sick leave by the Michigan Restaurant Association and others that have been at the forefront pushing back against it. We in Fight for 15, exactly. We have to demand it. And it's not just about electing people like me that won't sell out. You know, I don't take any corporate PAC money. And yes, you should find out who funds the people that you vote for. If you need help, I want to do I want to do a specific training to teach people when they go and vote for judges and other people, because it matters. It matters who's funding them. You have to find out if it's the GEO group and all these other folks. I mean, the same people that are detaining children and making money off of it are the same people that funded the inauguration committee for Trump. So just know you have to connect all of that. You have to figure out who's behind these folks that are going to go over there and make the decision. But in the meantime, hold us accountable. Protest me. Come and demand me. Like, don't ever stop holding any of us accountable. And let me tell you, the people power that we talk about, I mean, it is so real that I think sometimes we forget. We have these town halls, we talk to each other, we realize the information. But do you know how many people are still waiting for you to call them and knock on their door and say, we're going to go to the airport or we're going to go do this because this is what's happening? When I went door to door, I learned more about insulin and rationing and people going into shock and everything, not because I went to the Henry Ford Health Systems that's supposed to be a nonprofit, right? I went and spoke to my residents who taught me exactly what's happening on the front lines. Because one provider is telling one thing, right? Next week, it's a completely different approval process. You know who told me? Residents. Those are the ones who have the truth, and those are the information, the stories that you heard up here is what we need to elevate. And we do it through protests and through sometimes, yes, civil disobedience and demanding to be heard. And all of that is your freedom here in this country to basically call us out, to basically demand it, to basically not only just vote against us or vote for certain people that you believe in, but also to go down to your city halls and your the halls of Congress and demand it. You know, I love doing sit-ins. I don't care. I will get arrested for Fight for 15 tomorrow again. But it really takes movement work right here, Bob. I mean, Bob, you were one of the first people to come and speak to me at a UAW hall about the importance of making sure this was a real Medicare for all, not one that was going to sell us out to the for-profit healthcare plans and systems. And you all made me tread very carefully, right? You told me, expect this because this is what they did last time. Expect this because look out for global budgeting. You taught me that. You think it didn't make a difference? It did. I had never heard of those terminologies, but for the fact that you demanded a meeting with me, right? You didn't have to demand. It was pretty easy. And then you got a meeting with me, but you educated me. You didn't give up on me. You didn't assume that I would know. You were providing that information to me directly. Please, please know what a great opportunity right now. You got close to 100 new members of Congress that you can touch now that hasn't been completely, bought off exactly. You can go to them now and ask them. There's a bunch of new members in this Michigan delegation that many of them are waiting for you to call them and knock down their doors and say, we need Medicare for all. We need you to know this and that, and this is what we're expecting. But it really requires all of you so much wealth of information Bob has, institutional knowledge that can't be taught by other colleagues, but by the people that have been living, breathing it, and fighting for a single payer for over 20 years. So just believe in the people power. Believe that you have, the strength and the courage to really demand many members of Congress to hear all of you in regards to the fact that we need a humane healthcare system that doesn't feed into another system that's really covered, but it's for profit. So thank you all so much for having me. Thank you, thank you.
Wow. So, thank you, Congresswoman Tlaib. I want to thank our panelists that came out today for Mothering Justice. I want to thank Henrietta and Vernat from Michigan United, Daquan, Rokisha, and Bria from Mothering Justice for coming out here and sharing the story and doing the work. And you guys all have an opportunity. So today was exactly what Congresswoman Tlaib just talked about. Making sure that we are having conversations with our elected officials so that they hear our stories, they know our questions, so that when they go back to DC, they're fighting for us and not the special interests. And we talked about the Caring Majority Coalition. And every single one of you in this room can be a part of that coalition. If you want to learn more about it, we will have folks standing next to the cookie table to share a little bit more about what that Caring Majority is. And I want to just close with this quick point before I pass it back to Rashida to give us our closing remarks. So every single one of you here know the impact and know what we have to do and what's at stake. And we talk about what can actually get done. There's always this conversation of, we're not going to be able to get Medicare for all. We got to actually be realistic. And I want us to think about what that means. They're pushing a politics of the probable, what can probably get done with the system as it is. But every single one of you in this room, I don't think like that. You think of the politics of the possible, that if we come together and we organize and we hold folks accountable, what should the system look like? Let's develop a system as it should be, not as it currently is. And that's what every single one of you are going to be doing here today. And we want you to stay engaged with Michigan United. We want you to stay engaged with Mothering Justice. And we want you to stay in touch with Rashida Tlaib to make sure that she hears the issues that we want to fight for, and that we're pushing our agenda forward, a people-centered agenda, a healthcare system that doesn't focus on diagnostic codes and qualifications of what can get covered, but a human-centered system, making sure that we're caring for people that are caring for us, and making sure that they have the tools necessary to care for us when we need it. This is what every single one of you came in here for, and this is the work we're going to continue to do through that caring majority coalition and everything in between. So, Congresswoman, I believe she said she did wrap up. If you have any final words.
Thank you so much to Mothering Justice and the Caring Majority and Michigan United for their incredible leadership and engaging people. But even hearing this young man say, how can I get more people involved? How can I get my peers more involved? This is exactly how it starts, because I'm going to connect him to Denzel for BYP 100, because you got activists right here.
And
but I do want to recognize, I think the mayor of Highland Park.
Yeah, Mayor Yap. So.
Yeah, thank you, Mayor Yap, for so much. Oh yes, Labor Day parade. It's yes. Just want to thank him and the incredible staff here for hosting us. You know, this is a very small city. It's one of my smallest cities of the 13th congressional district. So it takes a lot of resources for us for them to put this event together and to have some staff here. So we want to appreciate his leadership in opening the doors for us here. So we really thank him so much.
All right. Of course. That's right. So. Once again, thank you, Mayor Yap, and thank you for the City of Highland Park for opening up this space for us to have our town hall. One more round of applause for our panelists, folks who are in the trenches and organizing. And one final round of applause for our Congresswoman in the 13th Congressional District, Rashida Tlaib. All right, so who's a part of the caring majority? Who here is a part of that caring majority? And who wants to make this caring majority bigger? So we all know what you all have to do. These folks up here can't do it alone. Every single one of you got to keep recruiting, have to keep sending that message. This is probably the most exciting C-SPAN event that they've had on TV. So there's no party like a 13th district party, so way to go, everybody. Thank you all for coming. And with that, I want to do one final push, so if all of you can say it with me together. On the count of 3, we say, we are the caring majority. All right. 1, 2, 3. We are the caring majority. Thank you and good night.
The C-SPAN Cities Tour is on the road, exploring the American story.